Hello, my name is Taryn Cortini, and I'm going to talk about the importance of prenatal care in America. Prenatal care is now one of the most used preventable healthcare services in the U.S., and its use is increasing over time. Prenatal care has played a big role in maintaining low weight birth rates and infant and maternal mortality rates down, therefore providing numerous maternal benefits. In spite of all the efforts made through research, prenatal care continues to be a debate among researchers and lawmakers as to the importance of delivering equitable, equal quality care to women in the United States, especially women from low income, poverty driven communities that lack access to such care. As future public health professionals at local, state, and federal levels, we need to address the current levels of struggles to improve pregnancy outcomes and reverse the current premature birth rates and maternal and infant death due to limited access to prenatal care. We need to evaluate the current programs at hand in healthcare that address prenatal care in America regarding accessibility, efficacy, and cost effectiveness of prenatal care programs. But first, what is prenatal care? The goal of prenatal care is to provide regular checkups that allow doctors and midwives to treat and prevent potential health problems throughout the course of the pregnancy, therefore promoting a healthy lifestyle for both the mother and the baby. The World Health Organization recommends at least 8 visits to ensure a healthy pregnancy and birth. In the United States, the maternal mortality rate is 17.4 per 100,000 live births. Studies find that the gaps exist among different racial groups for maternal mortality rates. Non-Hispanic blacks experience 37.1 deaths per 100,000 live births. Non-Hispanic whites 14.7 and Hispanics 11.8. How we compare to other industrialized first world countries is that women in the United States have among the highest rates of maternal mortality rates from complications at birth and highest among C-sections. Sweden and Norway have among the lowest on both. More than 1/3 of women in the U.S. report skipping needed medical care due to cost and accessibility. As we learned in this class, the U.S. has the highest healthcare rates than other countries. For example, the U.S. spends about $3 trillion in healthcare per year, 17% of total GDP, and it translates to about $11,000 per capita. In comparison, Sweden spends 11% GDP for healthcare and spends $5,200 per capita on healthcare. Sweden also has a tax-funded healthcare system ensuring that everyone has access of equal healthcare, therefore reducing the incidence of high infant and maternal mortality rates. My family has experienced tragedy due to lack of prenatal care. My cousin was pregnant about 10 years ago and did not seek prenatal care because she was fearful she could be deported. At the time, she was an illegal immigrant. At the time when she was ready to deliver, she went to the emergency room and was told that she had preeclampsia. Preeclampsia is a potentially dangerous pregnancy complication characterized by high blood pressure in a woman who has never experienced high blood pressure when she's not pregnant. This condition can be monitored by a doctor provided the women seek prenatal care. In my cousin's situation, because she did not seek care, the consequences of this condition proved to be fatal. She had a stillbirth with a full-term baby boy who weighed 10 pounds at birth. This situation could have been prevented had she been sure and confident that she wasn't going to be deported. So as of 2011, 13% of the population was born outside of the United States, mainly in Latin America and the Caribbean, and 50% born in Mexico. In the same year, 29% of the immigrant community have health insurance, but 74% reported not having any health insurance. because generally illegal immigrants are not eligible for Medicaid. However, studies have shown that even with health insurance, access to medical facilities and community health clinics are inaccessible in rural and poverty-driven communities. I have a hard time pronouncing rural. So now that we know about the situation at hand, let's explore how we, as future public health professionals, can do to effectively move towards reform to place importance in prenatal care. As the U.S. also moves towards focusing on the person in healthcare, future funds can be allocated to prenatal care research. This is important because we need to prove that accessibility to prenatal care is a benefit. We can create meaningful interventions to educate and promote that prenatal care is important, and it is a key factor to having healthy deliveries. It has been suggested by a study researched by the Public Health Reports that the following is needed to deliver equitable, equal, and accessible prenatal care to women in the United States. Number one, we need to definitely expand research on the impact of prenatal care and postnatal care, not only by measuring low birth weight, but also that the impact of lack of education, socioeconomic, and immigration status have on accessibility. 2, expand research on the adequacy of prenatal care utilization. Number 3, expand research on the impact of benefits of prenatal care. This is particularly an important step for federal funding to programs that target communities that need education-based interventions to change behavior. Expand research on cost-effective of all prenatal care and explore the impact of prenatal care on diverse populations by demographics, cultural, and socioeconomic characteristics. These suggestions and the outcomes of these research topics can push legislation to improve and place importance on the benefits of prenatal care in America. Access to healthcare should not be a privilege. It should be a right. Everyone has a right to healthcare. In a country that spends trillions of dollars annually to provide their citizens with equitable and equal access to care, especially for women and children of our nation. What can we do? We can donate our money and time to community centers serving marginalized communities and spread the word that prenatal care is important. Donate your money to institutions that help women and children. But most importantly, continue your studies in public health and encourage others to join in the field. It is my belief that a community that cares what happens to the people around can flourish even as we improve the broken healthcare system. Therefore, by educating ourselves, we have the responsibility to advocate for policies that impact legislation by conducting research that proves prenatal care is important. With the support of our government and the research conducted to prove its legitimate need, our government should take action at improving the quality of care and accessibility by creating laws that allows these underserved communities to gain access by providing infrastructures like community health care clinics and community-based interventions that provide equitable, equal, accessible, and high-quality prenatal care. Thank you so much for watching and have a great day.